All right, switching gears, a new chair can offer relief for a common medical problem in a very unique way.
Joining us now to share how it could bring restroom relief is medical reporter Liz Bonis. Okay, Liz.
Got your attention now, huh? There is something new in the tri-state. It's a thing, you might say. You sit in it and you find restroom relief. We stopped out at the Advanced Cosmetic Surgery and Laser Center in Norwood to share why some say it's the solution for a real going problem. It looks like a pretty high-tech place to sit, but for Julie Whitney,
I thought perhaps this chair could be the answer to my prayers.
After years of frequent restroom use,
I think I used to get up 2 times a night, now it's 4 times a night.
Julie says it was a long plane trip that led her to finally reach out for relief.
We just went to Rome. It was a 9.5-hour flight on the way back. I literally had to not drink any water on the flight, which is horrible.
So Julie consulted with the women's health team at the Advanced Cosmetic Surgery and Laser Center. She wanted to try something new.
It's called Emsella, and it's a new technology to help with urinary incontinence.
Here's how Emsella works.
This is something to tighten the pelvic floor muscles.
You simply sit in the chair, and it does in a short time what it would take a long time for you to do with your own body.
You sit on the chair fully clothed. It is equivalent of doing 11,200 Kegel exercises.
Karen Whitney is a physician's assistant. She says the M in Emsella stands for electromagnetic.
Basically, her pelvic floor is in the center of this ring of magnets. And so that magnetic energy causes muscle contractions at a rate much faster than what we can do on our own.
6 sessions, 30 minutes each suggested, and this may work best when used with other treatments, according to Dr. John Mendelsohn. Since there's no danger to sitting in it with or without a medical need, when I checked it out.
Oh yeah, there you go.
As for early results,
We know patient satisfaction, at least right now, and we do have MR studies, we do have ultrasound studies looking at the pelvic floor, and you can see changes as soon as like 1 or 2 treatments, actually.
okay, so
Wow.
yeah. Obviously not covered by your medical insurance plans, works out to about $400 a session. What's important to note is use this often with other therapies, and if your pelvic floor is not the problem, it's not going to fix the problem. You know what I mean?
Okay.
That's why you need to be fully evaluated by your own doctor to see if it's right for you.
That was really interesting.
Fascinating.
Yeah, I mean, honestly, and thank you for doing that. I mean, it's a serious problem, but it's
You
very
know,
unusual.
I have to tell you
solution.
that the people always ask you, what do you love about your job? And you know, it's great that we get to share it publicly. You know what the best thing is? You learn something new every day.
Yeah.
I had no clue
We
it
did.
existed.
And every time I see something, I'm like, wow. You know, years ago, we'd have never thought of that. People are looking for non-surgical solutions, non-medication solutions. This might be one.
I do love non-surgical.